Welcome to this video presentation on disease and treatment burden of spinal muscular atrophy on patients and caregivers in Canada, presented at the World Muscle Society Congress from September 28th to October 2nd, 2020. Spinal muscular atrophy, or SMA, is a rare neurodegenerative disease characterized by progressive muscular weakness. SMA can be classified into 4 subtypes based on age of onset and the motor milestones achieved. Type 1 SMA is the most severe and the most common, while Type 4 SMA is the least severe. Management of SMA is resource intensive, with patients dependent on caregivers throughout their lives. The economic and social impacts of SMA for patients and their caregivers have not yet been demonstrated in Canada. The objective of this study was to characterize the burden of SMA in Canada, including demographic and clinical characteristics, disease impacts, indirect costs, quality of life, and caregiver burden. Individuals with SMA and their unpaid caregivers living in Canada were surveyed using Qualtrics software from January 28th to February 21st, 2020. 2 patient support groups, Cure SMA Canada and Muscular Dystrophy Canada, invited their members to participate via email. Patient surveys were either self-completed by adult patients or proxy-completed on a patient's behalf. Patient surveys were proxy-completed either by caregivers of children with SMA or for persons diagnosed with SMA who indicated they needed assistance with the survey. Caregiver surveys were self-completed by adult caregivers of a person with SMA. Results were stratified by the self-reported SMA type. SMA type would be based on the diagnosis communicated by the clinician to the person with SMA and/or their caregiver. Overall, 965 respondents with self-reported 5Q-linked SMA and 962 caregiver respondents met inclusion criteria for this study. The median age of patient respondents was 9 years of age, and 59.8% were male. Approximately 25% of respondents reported being diagnosed with Type 1 SMA, 41% with Type 2, 29% with Type 3, and 4% of respondents categorized their diagnosis as other. The mean reported age at the first onset of SMA symptoms was 2 years of age, and the mean reported age at diagnosis was 3 years of age. The following figure presents patient-reported SMA-related costs in Canadian dollars. The median spend on assistive devices and allied healthcare services in the past year was highest for respondents with Type 2 SMA at $4,785 and $7,500 respectively. The median spend on home modifications was highest for respondents with Type 2 or Type 3 SMA at $15,000 for both subtypes. The following figure presents mean scores for the quality of life assessment using the EQ5D Visual Analog Scale, or VAS. The overall mean score for the VAS was 62.9, in contrast to a best health score of 100. The EQ5D VAS scores were lowest among respondents with Type 1 SMA and highest among respondents with Type 3 SMA. For the caregiver survey, the median age of respondents was 35 years, and 57.6 were female. Most caregivers reported being parents, with 52.5% being mothers and 37.9% being fathers. The mean age of the person with SMA receiving care was reported at 6 years of age. The following figure presents the substantial impacts on health reported by caregivers as a result of caring for a person with SMA. Overall, 45.7% of caregivers reported receiving respite care for exhaustion and physiotherapy for an injury associated with lifting or transferring. The majority of caregivers 63.3% also reported other impacts on their health associated with caregiving. The mean Caregiver Strain Index, or CSI score, for caregivers of persons with SMA was 7.5. Scores of 7 or above indicate a high level of stress. Caregivers of persons with type 2 SMA reported the highest mean CSI score of 8.1. The domains most affected by caregiving were changes in personal plans at 77.2%, disturbed sleep at 70.9%, and work adjustments at 70.5%. Study limitations. As the survey relied on self-reported data, it was not possible to verify that respondents had been either diagnosed with SMA or were caregivers of an individual diagnosed with SMA. Since the survey link was distributed by the patient support groups to their networks and anonymously completed for a potential incentive of $50 Canadian, some responses may have been completed by individuals who were not diagnosed with SMA or a caregiver of an individual with SMA. To conclude, building on international studies which demonstrate the economic and societal burden of SMA, this study reports the significant indirect costs and reduced quality of life for persons with SMA and their caregivers in Canada. Further investigation is needed to improve SMA-associated healthcare services in order to reduce the burden placed on individuals with SMA and those who care for them. This poster was produced by Medlior Health Outcomes Research. The study was reported by funding from Hoffman LaRoche Ltd.